With students back in college, there are new concerns around the next generation of doctors and who they're going to be, given the Supreme Court's recent ruling on affirmative action.
Yeah, recent numbers from the Association of American Medical Colleges showing nearly 6% of U.S. doctors identify as Black and nearly 7% are Hispanic. Now, some doctors are predicting that the lack of representation will only get worse. Dillard University Chief Medical Officer and LSU Health New Orleans Clinical Assistant Professor of Pediatrics, Dr. Corey Hebert, is here live with us this morning. Dr. Hebert, one of the reasons we wanted to talk to you about was diversity in healthcare, and why is it vital when it comes to healthcare workers and patient care?
Well, this whole Supreme Court thing, it has really shaken up our industry. The reason why is since September 24th, 1965, there's been a place set aside for African Americans so that we could actually be in the mix as far as medicine. Now, there was a study that came out at Harvard in 2002 that showed African American men are not taken care of as well as their white counterparts when they come into the ER for myocardial infarction or a heart attack, right? So we know that these things exist. We know that African American women are facing mortality rates during childbirth equal to some underdeveloped countries all over the world, dying on tables across America. We know this. This is not something that we think about, and it's something we don't like to talk about. But we have to recognize now that, in 1978, they had about 3.1% of doctors in school or medical school students were African-American male. In 2019, that was just 2.4%. And if you took away the historic medical schools, that's 2.1%, which means, African-American male doctor is like a unicorn now, and it's going to be worse because now there's really no place set up for you. Now, I have to be very clear here. I am not implying in any way that African-American men and women cannot keep up or not as smart. That's not the point. The point is that it's harder to get in. It's harder to get through it. And you have a lot of other issues that may come up when you are a minority trying to get into a medical school. If you make a B in undergrad right now, you ain't getting into medical school.
Wow.
That's the reality. And so that's just, it's just hard. And so we have underrepresented minorities now that are not going to be getting in, and it's a problem.
And doctor, when you talk about people not being able to get in, is that impact, and particularly in the wake of the Supreme Court's ruling on affirmative action, is that already being felt at collegiate pre-med programs across the country, at medical schools? I mean, what are you seeing exactly?
Well, it's looming because this just happened. And don't get me wrong. I mean, the numbers are so low that, it's going to make an impact. It hasn't made an impact yet because this just happened. But as the students are stirring around thinking, oh, my God, what's going to happen? I mean, when you don't have a place set and you know that right now you are competing, the playing field was leveled. Now, we know the difference between equity and equality. Right? Everybody can have the same thing with equality, but that is not the same as equity, because if you start off in a race and someone has a head start, you have to run faster to catch up. You can't run the equal speed. You have to run faster. And so as African Americans, we have to run faster to catch up because we start off behind. So right now, that whole concept is looming because when you started school in, say you're a sophomore right now, the way that you were trying to get to where you needed to be, that trajectory has changed. And so we will see this not next year because no school is crazy enough to say, well, there's no space, so we're not going to allow any Black people in school this year. No school is going to say that.
I'm glad you said that, Dr. Hebert, because I got to get this to you in the last 60 seconds before we let you go.
Yes.
Do hospitals and med schools have a responsibility, and how do they add people of color and stay diverse without affirmative action?
Recruit and support. They have Pacific Northwest medical schools and hospitals that there are no Black people, in some of these very small communities. But there are places that decided that they want to do it. They recruit doctors and they support them. They pay them what they need to be paid, and they support them all the way through. If you want to get people, any kind of person in any kind of situation, institution, or employment situation, you have to recruit appropriately, and you have to support them in the ways that they need. Otherwise, it ain't going to happen, and it's just lip service.
Because there is value to having doctors of color in medical facilities, yes?
If you don't have one, the Black people that get service are not going to get the best quality care. And it's just something that is proven. It is not something that's conjecture.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.